Hi everyone, it's Tara Bianca with Be Light Transformative Therapy, and today I want to offer you some self-massage and tension release techniques for the anterior neck. Specifically, we're going to be addressing a little bit of the SCMs, the trachea, the hyoid bone, and the floor of the mouth. Today, as I said, we're going to work on the anterior neck, so why would you want to do this? Well, when these areas get tense, which is quite common in people with some amount of dysfunctional breathing, by the way, it is much more likely that you will experience symptoms of acute stress and anxiety. And anyone who follows my channel for breathing guidance, it's also important to understand that these muscles, this area, is really responsible for keeping the integrity of the upper airways and really plays a big role in how air gets in and out of the body. So I'll be really curious to hear how your breathing potentially changes after doing this work today. You also have a number of important structures throughout this area, such as your carotid arteries, your internal and external jugular veins, and your vagus nerve. So any constriction or tension in this area can potentially start to block circulation in and out of the head, and can also cause irritation to the autonomic nervous system. Anyone dealing with phonation or vocal or swallowing issues is definitely going to need to address any kind of tension throughout this area. And also anyone who's suffering with that constant feeling of suffocation, that choking sensation in the throat, you're really going to want to address these areas, relax this tissue, and help the hyoid to descend out of the throat. Related to today's topic, I wanted to make a quick announcement. I just redid my entire website last week, which includes a brand new Be Light store, and which also means lots of new digital products. The featured products right now are these 3 brand new video series devoted to quick tips for anxiety relief. And through July 31st, I'm offering 15% off everything in the store. So I hope you'll check it out. I'm super proud of the new site and all of the new products that I created for you. I know they're going to be super valuable tools for adding to your self-care routine. For today's session, I want to start really superficially by addressing these SCM muscles, your sternocleidomastoid muscles. So that is the V-shaped muscle on either side of the throat. It's really apparent on me. You can see it very easily. If I turn my head, you can see it pop up. If I turn my head this way, you can see this one pop up. So this is a really superficial and obvious muscle, but it plays a huge role in our anterior neck and the structures that lie beneath it. Tension here can cause trigger points in other areas of the body, and it can start to constrict the throat and create a sense of stress and anxiety. So how are we going to address this muscle? So it's really tubular, and for the sake of simplicity today, we're just going to address each SCM for a couple of minutes just by squeezing, kneading, pinning it. So we're going to start up at the top, closer to the ear. So your SCM runs from this mastoid process behind the ear, and you can see it. You can follow the path very readily on me. And it comes all the way down to the clavicle, the sort of head of the clavicle, and a little bit lateral on the clavicle. So we're going to start by just pinching, squeezing, kind of kneading the SCM. So here we go. We're just going to grab it. So I'm really kind of under the angle of the mandible, kind of dragging the tissue from behind the ear as well. So I'm just pinning. Now your SCM is responsible for side bending, for turning your head away, right? Turning your head opposite the SCM that you are talking about, and also for flexing the neck and even slightly extending the occiput. So when we're working on it, we want to slacken the tissue. So one of the ways we can do that is side bending to the side that we're working on. You can even turn your head a little bit toward the one that you're working on. Good. And you can even bring your chin a little bit towards your chest. So this really slackens this tissue so that it's very easy to kind of grab and manipulate. So we're just going to grab it, squeeze it. So I'm squeezing and just holding for a second and breathing. So through this whole session, unless I kind of guide you to open and close your jaw, which you're free to do at any moment, we're really going to just keep the lips gently closed You can think about keeping the tongue in contact with the roof of the mouth, and you can think about gently breathing in and out through the nose. So I'm just grabbing, pinching, holding, and releasing. I'm grabbing, picking up the tissue. So you can see it's tubular, it's very easy to grab. Grabbing, I'm pinching, so I'm literally bringing my index finger, the side of my index finger, to my thumb. Good. Grabbing. So now when you get to the bottom, closer to the clavicle, it narrows, right? It's a little bit trickier to grab. So go ahead and laterally bend your head toward the SCM that you're working on. Bring your chin a little bit forward towards your chest, and it slackens the tissue enough that you can grab it. Be gentle with yourself. This is not the most intense, aggressive work that you're ever going to do, right? We're working in a really sensitive area. A lot of us never touch these muscles. SCM can get really sore. You can get trigger points in here. So just being gentle. So I'm just picking up this tissue and kind of scooping through it. And if you feel like your skin is very, very dry or it's uncomfortable to work in this way, you can add a little bit of carrier oil, plant oil to your neck and throat if it helps you to slide a little bit. And I'm just picking and grabbing, just trying to loosen the tissue. And I'm kind of going from the top of the SCM closer to the ear. And working my way down towards the clavicle bit by bit. And you can kind of start to add in some gentle range of motion, whatever feels good to you. As this tissue starts to open, you don't have to keep it in this slackened position. You can start to stretch it a little bit, make it more taut. So you can play around with it. There's no rules. This is really an exploration today. Good. I'm working my way down towards the clavicle again. Good. And maybe one more time up towards the ear. And we're going to work on the other side. Okay, so same thing on this. I'm working on my right side now. So if I want to slacken the tissue, I can side bend to the right. I can flex my chin a little bit and I can rotate towards the SCM that I'm working on. And look at this tissue is really soft. It's really slackened. Now I can grab this so easily, much more easily than if I'm in this position, right? So I'm slackening the tissue and I'm just grabbing with my finger, my index finger and my thumb. And I'm pinching, squeezing, and just pulling a little bit. So pinching, squeezing, and just pulling a little bit. Pinching, squeezing, and pulling a little bit. Pinching, squeezing, pulling. Good, so it should feel really relaxing. You might hit some tense spots. If you hit a real tense spot, a painful spot, a trigger point in there, just hold it gently and just breathe for a few breaths to your tolerance and let the tissue sort of melt under your fingers. So you can see again, it's very tubular. I'm just grabbing the tube and just manipulating it. We don't need to overcomplicate the hand techniques. We don't need to overthink it. Just grab the muscle and move it around. Good. So I'm just working from up behind the ear, as close to the behind the ear as I can get, working my way down towards the clavicle. Right down here, it's harder to grab. So I'm going to bring my chin to my chest a little bit just to slacken a little. And now I can grab that tinier portion of the SCM that attaches to the clavicle. And breathing. Good. And you just do a few passes up and down, up and down. So I'm moving back up towards behind the ear. Starting to warm up the tissue of the anterior neck. If you feel any discomfort, any sharp pain, if you feel too strong of a pulse, if you start to get dizzy or nauseous, back off of this exercise today. Good. Okay, excellent. And pause for a moment and just get a sense of how your neck feels. Does it feel any different just from working on these two muscles, one on either side? Okay, so now we're gonna work on the trachea actually, which may sound a little strange or a little scary to some of you. So let's start first by palpating the area, just so we can get our bearings and get a sense of what we are touching, what is underneath our fingers. So I'm gonna ask that you do this palpation with really light finger pad pressure. Whenever we're palpating, why is it important to use light finger pad pressure? Well, number one, in this area in particular, it's a very sensitive area and we don't want to push too hard, right? We don't want to hurt ourselves. But more importantly, you don't want to numb out the sensory information coming into your finger pads. And if you press too hard, you're going to totally numb out that perception, that sensory perception, and you're not going to actually be able to feel what's under your fingers. So always, even though it sometimes seems counterintuitive, lighter pressure results in more effective palpation. You can feel more. So just take your fingers really lightly, one hand or both hands, and just gently go on your throat and just rub. Just take the skin with you and just rub it up and down. So I'm not even putting any inward pressure. I'm just moving the skin around and I'm just noticing the contours of that tube underneath my fingers, right? And so you'll feel it's very bumpy, yeah? There's a lot of different things going on in there. So let's identify them, and I'll be sure to include a picture up on the screen also so that you can get a better sense of where we're actually going with our fingers. So let's start at the top. So we're going to start at the hyoid, which might be the most challenging to feel, but let's go for it just to experiment. So you're really thinking about this crease, right? This crease where the floor of the mouth, the chin, connects into the throat. So it's really this separation point. And if you gently put your fingers in there, sometimes I like to use my index and my thumb, you'll feel, and maybe you won't feel today, and that's okay. I can remember when I first started learning how to address this bone on my clients, I couldn't always find it, right? And it was because I was a little afraid to go into their throat. Quite honestly, I thought it was going to be uncomfortable for them. And that perception of fear of it being something scary made me incapable of really feeling what was under my fingertips. I was more in my head and not really in my body. So if you can't feel it today, don't worry. Eventually it'll pop up. And also just addressing the tissues in this area, you're still going to get an effect, even if you cannot feel that hyoid exactly. So take a moment and just with your thumb and your index finger, just sort of feel into this space. So a little gentle pressure and just slide across that area. And just notice if you feel a very thin bone in that area. So we say that the hyoid is a horseshoe shape, and that's true. And it's narrow, it's only as wide as the trachea. So you don't want your fingers too wide. You want it really narrow, and it's very thin. And so you're just feeling for this thin bone, this thin horseshoe, this horseshoe-shaped bone. And so your mind is pretty powerful. If you look at the picture of it and then you just know that it's there, you're much more likely to feel it because it is there. So you will feel it eventually. Okay, so you find this hard bone. We're going to come back to this bone later and work on it a little bit more. But I've got news for you, especially in a sensitive area like this, just palpating sometimes creates change in the body and starts to calm the nervous system. Okay, so as we go down from the hyoid bone now, you don't have to go down very far. So here's my hyoid. You don't have to go down very far. You'll feel another bony structure. And you'll notice that there's a little apex on this one, right? And on men, it's going to protrude more. This is our thyroid cartilage, right? And this is what we refer to as the Adam's apple. So my guys watching, you're going to feel that much more distinctly. But women, you should be able to feel this easily too. So you'll feel there's a hyoid bone. There's a little bit of like dead space, empty space. And then you run into another hard structure. And this hard structure has a point on it, almost like I imagine like a tent, right? But the tent is coming forward towards the camera. So that's your thyroid cartilage. And then as you sink below the thyroid cartilage, probably only enough room for a fingertip to go between it, you'll feel there's a little hole, little empty space, and then you run into another hard piece of cartilage. So that's your cricoid cartilage, right? And as you continue to go down, you'll feel like, oh, There's one separation, there's another separation, there's another one. It's almost like a ladder, right? There's rungs on a ladder that you keep running into. There's dead space and then a hard piece of cartilage, and then dense space and then hard cartilage. So that's how the structure of your trachea kind of works, yeah? So we're going to now address and sort of manipulate these areas to create a relaxation effect. Okay, so we're going to start with this general tube of the trachea, and we're just going to think about rocking the trachea back and forth. So I'm taking my soft, this is not where we're going very deep, soft pads of my fingers, and I'm just thinking about from the top of the trachea, I'm just pressing it towards the right and displacing it from its central position. And then I'm going to use my thumb and I'm going to rock it to the left. So I'm just dragging down the edge of that tube. Now notice I can talk while I'm doing this. I can breathe while I'm doing this. It's no problem. I'm being very gentle. So if anything hurts, adjust your pressure, adjust your fingers. If you're feeling a very strong pulse, if this is making you anxious, if it's making you uncomfortable, if you're getting any nerve pain or any discomfort at all, just stop for today. Maybe this is not the right exercise for you. But otherwise, it should feel pretty relaxing. Usually when I do this work on my clients on the table, they fall right to sleep. This is a really nourishing move for the nervous system. So remember, our vagus nerve runs deep to this area. And as we release tension from the body, we're also releasing that sense of fear, that sense of holding, that sense of guarding. We're allowing the nervous system to take on a sense of safety. And that allows us to go into rest and digest, rest and recovery. It even allows us to just fall asleep, right? So this should have a very nurturing, rocking feeling for you. And so don't be afraid to just rock that thyroid cartilage and that tube of the thyroid back and forth. And then, so I'm sliding right now, but we can also think about just letting the fingers sink a little bit more deeply and then pressing into that tube and holding for a second. So now I'm holding the trachea displaced toward the right, and I'm just breathing. And now in some people, especially if there's a lot of anxiety, a lot of panic, a lot of fear, or if there's some amount of breathing dysfunction, that trachea can shift, right? It can deviate more to one side than the other. It can be displaced because of muscular imbalance. And so we want to get it back to a neutral position so the airway can be as open as possible, so that the structures behind it, things like your esophagus, your pharynx, your esophagus, are also aligned, so that swallowing is happening more effectively, so that phonation is happening more effectively. Good, and I'm just pinning and holding and breathing. And as usual, this is very quiet work. It's not the sexiest thing in the world. It doesn't even make for good television, really. But if you're open to trying these tools on your own, I promise you're going to get a really powerful effect. Okay, and I'm going to go a little bit lower, and I'm just going to sink in a little bit, go to the right a little bit. I'm sinking into the trachea, displacing it towards the right, holding and breathing. And you should even feel it pulling all the way up to the level of the hyoid into the floor of the mouth, right? We're warming up all of these tissues. They're all connected. Now I'm going to take these fingertips and I'm going to think, instead of dragging down, I'm going to drag up. And you're going to notice it feels different. You start to pull the tissue out of the thorax a little bit. It creates a lift, like you can finally lift your chin, like you could get more air in. So again, between this SCM muscle and my trachea, there's a space. I'm going to sink into that space. So you see my fingers are sinking a little. I can still talk. I can still breathe, no problem. And I'm just thinking about having a little upward intention. So I'm thinking about dragging my fingers up towards my head, but I'm barely moving. And now if you really want to, you can create a counter strain with the other hand. Just take that tissue right over your clavicle and pull it down. And you should feel this skin behind these fingers start to mobilize. Good, let's do that again. That feels really nice. So you're sinking in between the SCM and the trachea. You're giving a little upward intention. You're taking the opposite hand at the clavicle and you're just pulling that skin out from behind the fingers that are on the throat. I'm continuing to glide all the way up. Let's do that one more time. So you're sinking in between SCM and the trachea. A little bit of inward pressure, a little bit of upward pressure. Take the skin of the clavicle, counter strain, and drag that tissue from behind the fingers that are on the throat. Let those fingers drag all the way up. You can even extend your head if that feels good. Really nice. Okay, so now we have to do the other side. We're gonna drag the trachea to the left. So taking a couple passes, just dragging your fingers across the edge of the trachea. So I'm really starting up high. And you can see I find that tube, right? You see it moving. You can see I'm pushing the thyroid cartilage, right? So men, if you have an Adam's apple and you're looking in the mirror, you'll see the Adam's apple deviate to the side. And I'm just pulling. And so if you start to feel it pull into the mandible, pull into the lips, pull into the face, you can counter strain with some kissy lips, or you can take the skin on your mandible, on your chin, and literally pull it the other direction. So a lot of times that counter straining helps. So on this side, I feel tighter and I feel it really pulling almost all the way up into my eye. So you can see my fingers disappear a little bit. They're pinning into the side tube of that trachea. And they're also dragging with a little downward intention. Let's do that one more time. So I'm just pinning. Hopefully you can see okay. And so here I feel a little stuck. I feel like it's pulling too high. I'm going to take this tissue and I'm just going to counter strain away. Good. And I'm going to sink again here, re-engage the tissue, and I'm going to counter strain away. Good. And now we'll go the opposite direction. So take the fingertips. You're going to sink in between the right side of the trachea and the SCM. And you're just going to sink in there. And you're going to go with a little bit of upward intention now. So I'm dragging my fingers up. Gently, softly. I'm not digging deeply. Notice I can still speak without any problem, breathe without any problem. If you feel a strong pulse, nerve pain, dizziness, nausea, lightheadedness, back out, please. This is not the exercise for you. Okay, I'm dragging up, and now I can take the other hand, the right hand in my case, grab that tissue over the clavicles and counter strain it down as I continue to drag my left hand up towards my throat. Let's try it again. So I'm going between the trachea and the SCM. Just direct fingertip pressure, a little bit of inward pressure. I sit up, I'm dragging my fingers towards the ceiling. And then as I continue to drag them up, I'm taking the right hand, grabbing that skin over the clavicle and pulling it down. As I pull it down, I feel this tissue behind the fingers on the throat pulling downward. Creates a nice release, a nice stretch on the tissue. Let's do it one more time. Taking the fingertips, sinking between the trachea and the SCM. Good, and you're going up towards the ceiling. As I start to drag upward, I'm taking the right hand over the clavicle. I'm pulling that tissue down as I continue to drag my left fingers up towards my throat. Excellent. Taking a moment again to just see what's changed in the body. Do you feel more relaxed? Do you feel your nervous system calming down? Do you feel yourself going more into rest and digest? And if not, that's okay. This is your personal experience. I'd love to hear what you are experiencing. Okay, so now we're going to return to that hyoid bone. So again, your hyoid is this horseshoe-shaped bone. It's the only bone in the body not to articulate with any other bone. So this swallowing bone, as we sometimes refer to it, this swallowing bone is literally suspended by a bunch of strapped muscles, right? So you have your infrahyoid muscles, which connect the hyoid down into the thorax. And then you have your suprahyoid muscles, which we also sometimes refer to the muscles of the floor of the mouth, which we're going to work on today. Is connecting it towards the mandible, right? Your tongue also is rooted onto your hyoid. So every time you swallow, your hyoid moves, right? Every time you speak, there's a little movement in the hyoid. Now, because it's a floating bone and it's dependent on all these different muscles to keep it balanced, it's often on a slant. It's often imbalanced, right? It might be on a slant. A lot of times for a lot of people, it gets stuck in an ascended position, and you might experience something like suffocation, or you might feel like you're literally being choked because you are. Your hyoid bone is sitting way too high up in your throat area, And sometimes we just need to encourage it down. So we're going to keep this very simple today. You're just going to take your fingers in the shape of that horseshoe. And again, you know what it looks like now from the picture. You know where it is. So you're going to feel it. And if you don't, it's no big deal. You're still going to be addressing those hyoid muscles, whether you're totally confident about your palpation or not. So you take your fingers in the shape of the horseshoe. And remember, it's only going to be as wide as the trachea. So it's not going to be this, right? It's a narrow guy, a narrow little bone, thin. And I want you to just to very gently rock back and forth. So again, I'm very high up. I'm right where right where the floor of the mouth meets the throat, right? So it's really high up. And I just want you to rock back and forth with gentle pressure. So I'm using my thumb to rock my hyoid and the attached muscles towards the left. And then I'm using my second and third finger to gently rock that hyoid towards the right. And in the process of doing this, again, we're starting to relax the muscle attachments, but we are also stimulating this relaxation response in the nervous system. Now, if you have any trauma to the throat, if you have suffered with some incident of suffocation or choking in the past, it's very likely that this is going to be uncomfortable for you or that you're going to feel very guarded working here. There's probably a lot of trauma stuck in here. It would be very probable that you might start to express a lot of emotion when working on this area, or some fear might come up for you. I invite you to go there. I always think it's good to start to address those areas of trauma holding in the body, but you want to do it gently and you want to do it with conscientiousness. So it's your body, it's your hands. Only do as much as you feel comfortable doing ever at one time. And if the emotions come up, try to be with it for a few minutes, try to breathe through it. And if it gets to be overwhelming, you just stop for the day and you come back to it another time. But gently, bit by bit, starting to release those areas of holding, starting to release those areas of trauma. Good. So I'm just rocking. And now I'm going to take my thumb, rock it to the left, rock the hyoid to the left, and just hold for a minute. Let's just take 2 or 3 breaths. In and out through the nose. Good. So I'm just gently holding it to the left, taking 1 more breath. And we'll go the opposite direction. Now my second and third finger, we're going to gently press the hyoid towards the right. Again, I'm going to pause and I'm just going to take 2 or 3 breaths here, holding the hyoid, deviate it toward the right. Really nice. And now we're going to take those finger pads again, and we're just going to start to scoop from the mandible down towards the hyoid. So we're going to start to gently address these suprahyoid, meaning above the hyoid, or floor of the mouth muscles. So in a really general way, we're just going to take our finger pads gently, and from the mandible, we're just going to stroke down. From the mandible, we're just going to stroke down. And if you ever see me doing this kissy lip or this pouting, it's because I'm trying to counter strain the tissue away. So you can experiment with that as well. Now another way to counter strain would be to take one hand and start sliding, and the other hand takes the tissue in the opposite direction. Right, so one hand goes to the mandible, starts to drag towards the hyoid, the other hand goes on the mandible and drags up towards the head, towards the eye. And again, dragging from the mandible towards the hyoid, the other hand on the mandible drags away towards the eye. Good, let's go to the other side, taking both hands and just dragging for a couple passes from the mandible towards the hyoid. So it's not a lot of space. You're just dragging through the floor of your mouth. Make it relaxing, make it gentle, make it nourishing. If you find a spot with a lot of tension, you can stay there a little bit and just breathe. So I'm just dragging and spreading. Now I can also, in this case, take my left hand, drag down from the mandible towards the hyoid, take my right hand on the mandible and drag away towards the eye. So I'm straining and counter straining, dragging and counter dragging. So again, coming to the mandible, dragging towards the hyoid. I feel this pulling through my cheek, through my eye. I'm gonna grab the tissue on the mandible and counter strain away. And again, from the mandible, dragging towards the hyoid. The right hand goes on the mandible and drags away. Good. And now let's go to the center of the chin. So I'm right behind the mandible, and I'm just dragging with gentle finger pressure straight back. And I'm gonna carve out the throat essentially. So I'm just coming back, gentle finger pad pressure, right? So I'm using the gentle pads. I'm not putting a lot of upward pressure. I'm really being very soft and gentle with myself, inviting a sense of safety and a sense of release from those muscles. So I'm just dragging back. And when I hit that hyoid at the junction between the floor of the mouth and the throat, I'm just gonna spread laterally, right? So I'm kind of carving out that throat. And one more time, dragging those muscles of the floor of the mouth towards the hyoid. And then carving it out laterally. Really good. Now we can take our thumbs and we can just sink into the floor of the mouth. So I'm reinforcing them like this so that my hands don't get tired. And I'm just taking, again, the pads of the thumbs. And I'm going right behind. Here's the tip of the chin. I'm just dropping about a ½ inch behind into the soft, fleshy, muscular part. So I'm off the bone. And I'm just sinking onto my thumbs. So let the thumbs fall into the soft tissue of the floor of the mouth. So some of you might have trigger points here. You might feel a lot of discomfort, a lot of tension. Go gentle with yourself, go softly with yourself, and really just take the time to take slow, deep nasal breaths and just hold in that place. Just pin it and breathe and let the tissue softly melt. Good. I'm just repositioning because I'm sliding. Good. Okay, now let's work one side of the jaw and then the other, and then we'll start to conclude for the day. This video got a little longer than I expected, as usual. So I'm going to go all along the right side of my mandible, and my hand is going to be in this position, but I'm really thinking about working the thumb side right now, and then we'll come back and work the finger side after. So I'm really working the thumb side first, but I'm thinking about pushing like this, pushing like this, pushing like this. So I'm pushing up towards the head, and then I'm going to drag back towards my ear. Push up towards the head, drag back toward my ear. The thumb is doing most of the work, staying really close to the bone, to the mandible itself. So I'm pushing up, and I'm thinking about dragging back. So I'm pushing up, and I'm thinking about dragging back. I'm pushing up, and you notice I keep moving back closer to the ear, step by step, and I'm dragging back. Let's do a couple more passes like that. So I'm sinking and dragging the thumb. Sinking and dragging the thumb. Sinking and dragging the thumb. Really nice. And now when I do this, I'm doing that same position, but I'm going to think about the fingers working now. So I'm really going to dig into this tissue on the mandible itself. So I'm digging in and I'm pulling. And as I pull, I use my lips now to counter strain. So I'm digging into the mandible, pulling away. So my thumb is making a little contact, but it's not my focus now. I'm focused more on the fingers. Digging into the mandible, and I'm really digging in a little bit harder here because these muscles get really tired and they can take a little bit more pressure. And again, digging into the mandible, pulling back. Let's do one more pass like that. So starting closer to the chin, digging into the mandible. You can do a little back and forth like this to really feel the contours of the bone. Dig in, pulling back towards the ear. Dig in, pulling back towards the ear. Dig in, pulling back towards the ear. Let's go to the other side. So that same thing now. Pushing up, dragging back. Pushing up, dragging back. I'm going to focus more on the thumb on the underside first. So starting closer to the chin, I'm going to sink in and I'm going to drag back. And I'm going to sink in and I'm going to drag the thumb back. And I'm going to sink in and I'm going to drag the thumb back. Let's go again like that. So starting closer to the chin, I'm going to sink up towards the head, drag. I'm going to sink towards the head, and I'm going to focus on the thumb, drag, staying close to the bone of the mandible, and sink and drag. Now we're going to do that same thing, but we're going to focus on the finger pads on the mandible itself. So my thumb is still going to be there, but more of my focus and intention now is on the side of the mandible. So starting close to the chin, I'm going to dig in. I'm going to rock back and forth a little bit. It should feel a little sore, but it should feel good. And I'm going to drag back, and you can counter strain with your lips by going the other direction. And I'm going to sink in, back and forth a little on the mandible. And I'm going to sink in. So I'm just working my way from chin to corner of the mandible, right? Good. Let's do another pass of that. Sinking in closer to the chin. So I'm really thinking about these finger pads pressing into the bone. I'm going a little bit more aggressive here. And sink in and drag. And sink in and drag. Really nice. So now just to finish up a little bit more symmetrically, I always like to work on both sides at the same time. So you're going to take that same finger position. You're going to start at the center of the chin. The thumbs are making contact on the bottom. The finger pads are making contact on the mandible itself. And without a lot of thinking about it, we're just going to drag back. So from the chin itself to the corners of the mandible on either side. And I'm counter straining with my lips a little. One more time. Good, and then to finish it off, we're just going to take our finger pads again, nice and soft, and we're going to drag from the tip of the chin all the way down. And you might even add a little flexion and extension to the neck. And when you get over the front of the throat, be gentle. Good, we're going to do 2 more passes like that. So you can see the path of my fingers is from the tip of the chin, down the floor of the mouth, across the throat itself, over the clavicles, and into the pecs a little bit, right? So I'm ending on the chest. Here we go again, starting at the corner of the chin. And I'm just gently flexing and extending my head. And notice how that changes where you feel the opening and the pull. And my fingers are just gently pressing into the tissue and very slowly dragging towards my feet. And the movement of my head is helping to create that drag. Good, let's do one final pass. Taking the finger pads, dragging back, gentle. I'm not pressing in with a lot of pressure. I'm thinking about just gently feeling the contours of my throat. Good, so as I flex my head, it slackens the tissue. And then as I extend, it stretches the tissue, and I feel my fingers gliding towards my feet more. Good. Excellent. And then just take a moment, open and close the jaw a couple times. Notice how that feels. So we didn't even do specific TMJ work or jaw work, but we did work around the mandible and the floor of the mouth and a little bit at the root of the tongue. So notice if it feels easier to open and close the mouth. And then with your eyes closed, just for a moment, with a nice upright posture, just take 1 or 2 breaths in and out through your nose. Lips are gently closed, preferably tongue making contact with the roof of the mouth. One more breath. And just notice what's shifted in your body. Do you feel different physically? Do you feel different emotionally, mentally? Is your nervous system in a different place now than when we first began the session? And has your breathing changed in any way? And if so, how? I'd love to hear about it. That's all for today. I hope that you got some benefit out of today's session. If you're open to sharing, I'd love to hear about your experience with this work. And if you have any questions or feedback at all, please leave those in the comments below. If you liked this video, please give it a thumbs up and please subscribe to my channel. Also, please check out my brand new Be Light store with lots of digital goodies for your breathing, tuning fork, and self-massage education. If you're looking for a more structured breath program, then please check out my totally free Breath Basics 6-Day Challenge. And if you'd like more FaceTime with me behind the scenes, including live monthly Q&As and also live monthly guided breath sessions, then please consider joining my private online Be Light community. And lastly, if you'd like to further support the channel and the work that I do here, you may do so by visiting my Buy Me a Coffee page. Thank you so much for watching, and I'll see you next time.